Marlene Sidon is a healthcare leadership consultant and coach with extensive experience spanning from clinical work as a respiratory therapist to executive roles in major healthcare organizations, including Kaiser Permanente and Emory. She specializes in service strategy, process improvement, and employee engagement with a particular focus on enhancing the care experience for patients, teams, and physicians through systemic improvements. Marlene, please tell us about your work and then ask for what you need and offer what you can.
Dawn and Denise and this great community that you've started, and it's been an honor to just spend time with you. So I want to just start with a little story. I have the heart of the healing profession and always wanted to be in the medical field, and started my career as a respiratory therapist. Before then, I actually worked in a bank for a little while and thought, well, that business community might be a great avenue for me. But I quickly learned that I really didn't care about anybody else's money but my own. But what I did care about was helping people feel better. And that brought me back to that foundation of health and healing. And as I experienced being a respiratory therapist, working with patients, I really had a great opportunity to see what the patients needed, and also to see the experience of the doctors, the other teams through many different avenues, whether it was the emergency room in code situations or in intensive care, or just being at the bedside giving therapy to a patient. So many different dynamics and different needs. And then with the opportunity to be in healthcare leadership, looking at the different demands that we had there, I really got to put on a different lens of looking at how can we make this better? How can we improve things? And the patient was always my focus, looking at how do we improve the experience for the patient? And through that journey, understanding the patient needs, I also saw that the needs of the teams and the doctors were just as important, if not more important, to be able to address first. And that started my focus on the whole collaboration between the patient and the team experience, because they really go hand in hand. And so that takes me to the work that I do as the principal consultant for service quality solutions. I work with healthcare organizations and address where they are within that service dimension. And so if an organization needs someone to help them create their whole service strategy, looking at the values of the organization, the culture, and the alignment with who are the right people that match that culture and that alignment, what are the right behaviors that we need to have to create that great experience and build that whole format. That's something that I would help organizations with on the big picture of their service strategy. Another way would be looking at individual needs that the organization has. Is there a process that isn't working? Is there a problem with retention? Is there somewhere where they're getting more patient complaints? And so I can dig deep into those different areas and find out what are those barriers, what are the things that are causing those issues, and work with the teams or the patients to really uncover those barriers, to remove them, and create a process that's going to restore their ability to do the work that they want to do. And then the third area that I work in would be to help with leadership development. So help leaders with their communication skills and understanding the different communication skills of their teams. I would provide DISC consultant opportunities to be able to help them identify and understand that there are different communication styles, how to use them and apply them, and connect with others who may share a different style than they do. And I would help them with those tools and with their team with those communication styles and skills. So those are the three ways that I would support and work with organizations. And I would really appreciate what you could do for me as this community would be to connect me with individuals who are in need of any of those services in your network and community. Help me with understanding some best practices that you've seen in those different areas, and just to collaborate on those as well. I would be happy to partner with you if you are working on a project in any of those areas that you see that my support could provide value to you. And then what I can offer the community is the skills that I have with the communication coaching, the service strategy, any workshops that you would need in those different areas. I would be happy to help you with that. And then just to continue to learn and grow from each of you, that is one of the greatest pleasures of this community, I think. We've got a great group of experts. So thank you for this time, and I appreciate the opportunity to share what I do.
Great. Thank you, Marlene.
Marlene, you mentioned that you're skilled in DISC. Can you describe a little bit about what DISC is and the value of doing that assessment?
Sure, thanks for asking, Denise. So DISC is a personality communication style assessment, and there's a lot of different assessments, Myers-Briggs and others. And so DISC is another variety that looks at some different aspects. And it really helps people understand where their communication style is and the differences between the way they see the world and the way they communicate. So like a D could be a very directive kind of personality style. I would be influencing, S would be steady, and C would be more analytical and logical. And so everybody approaches life in a different way. And there's also combinations of communication styles. So it's not always just one area. And so understanding how people are kind of set up to communicate helps you understand even nonverbal cues. So you walk in a room or you walk in an elevator, and you can really tell by somebody's body language and even how they're interacting as they get on an elevator. You can get a sense of their communication style. And it really helps you appeal to that when you're trying to speak with somebody and understand them. And so providing that assessment and teaching that background to others is a great way to build relationships and good communication with each other.
I'm curious how you go about bringing in best practices and working with those that your clients in order to identify what it is they need and how then to move forward with the work that you'll be doing in consulting and guiding them.
Yes, that's a great question, Denise. And it brings me back to a recent experience that I've had. I've had the honor of being trained with the Sterling Institute, which is a Baldrige group for Georgia and Florida. And one of the key foundations with that, with performance excellence, is understanding the goals of the organization. And so that would be the first step. You know, what is important to you, Hospital X? You know, what are your values? What is your culture? And based on that, then I would look at best practices in the areas that are compatible with what's important to them. And that's really important because I would never want to go in and make assumptions. And so really understanding what's important to them first is the first step.